Hello, I'm Michael Davey. I've been a doctor for 28 years and I'm also a qualified counsellor who runs emotional wellbeing workshops for healthcare professionals. In this short video, we will discuss how you can process work-related emotional trauma with your colleagues. Doctors and nurses are admired for their ability to just roll up their sleeves and get on with the job. And this is certainly true during the current coronavirus outbreak. However, one of the reasons for a high rate of burnout in our professions is a collective underestimate of the traumatic nature of the job that we do and its impact on our emotional well-being. We are with patients and their loved ones at their weakest and most vulnerable as they experience anxiety, sadness, pain and loss. Sometimes we actually cause distress with the bad news of our diagnoses and prognoses. How could we possibly not be impacted by these things? The good news is that if we allow ourselves time to process work-related emotional trauma, then it doesn't have to have a lasting impact on our health, as long as we start the process as soon as possible after the event. So I'm going to outline for you a simple way to process a traumatic event with a colleague. But first, let me emphasize, this is not a substitute for professional counselling when required. Firstly, inform someone else in your team about what you're doing. Then find somewhere that is quiet and private to chat. If possible, make a cup of tea or at least provide a glass of water. Ask your colleague to outline the traumatic event, and as you listen, focus on their thoughts and feelings rather than the facts. As you go along, encourage them to expand on their feelings by reflecting them back to them. It might go something like this. I feel guilty. Guilty? Yes. Like it's my fault, like I'm not good enough. Avoid the temptation to fix them with well-meaning countermands to their thoughts and feelings. Instead, your role as the listener is to empathize and let them know they are being heard. You are journeying with them as they process the event in their own way. Acknowledging and validating their thoughts and feelings will encourage them to open up more. So, for example, you might say, it sounds like that guilt is really weighing heavy on you. Of course, they may need to cry. Usually when someone is crying, you are best to say nothing. A tissue, a hand on a shoulder, and your presence is all that is required. Sometimes when the tears are beginning to die down, I ask this question. If those tears could speak, what would they be saying to you right now? It's not unusual for the answer to be words of self-comfort. The tears are saying, you did your best, you couldn't have done any more. And how do you respond to hearing that? Well, I think they're right. I did everything that I could. Another helpful question is the I wonder question, which might go something like this. Given the pressure that you were under, I wonder if in fact you did the best that you could. The word wonder allows you to gently offer an alternative interpretation without forcing it upon them. Yes, you're right, I did my best. I did everything that I could. At the end of your chat, ask them how they are feeling now. Send them on a break for some food, drink and fresh air. Encourage them not to start working again until they feel ready. And if they need more immediate support, consider involving the hospital chaplaincy or counselling service. Check in with them again before the end of the shift, and again check in 2 to 3 days' time. It will be an encouragement to you, the listener, to hear that they are feeling better, and if they are not, then you have the opportunity to suggest that they seek further help. Most hospitals have a counselling service, and GP practices will have their own local arrangements. Free telephone counselling is available nationwide from the Practitioner Health Programme, the British Medical Association, the Royal College of Nursing and the Medical Protection Society. You can also find a local private counsellor by using one of the counselling directories online. So, in summary, take the opportunity to process traumatic events with your colleagues as soon after the event as possible, paying particular attention to thoughts and feelings, and reflect these back to them to encourage further expansion. And remember, you are not there to fix them, but rather to journey alongside with them as they process the event and begin to emerge on the other side. What a privilege. I hope that you found this useful. You will find other emotional wellbeing videos and resources on my website, drmichaeldaveywellbeing.co.uk. And thank you for all that you are doing. Stay well.